Hi, my name is Dr. Nima Rahmany, and I'm here at the Westgate Wellness Center for Physical and Emotional Trauma. What I'm about to share with you is a solution to one of our healthcare system's greatest inefficiencies, and that's how we deal with mental disorders like post-traumatic stress disorder. Now, I'm not saying that I have the cure, and I'm not saying that I treat mental disorders and conditions like post-traumatic stress disorder. I teach a self-healing tool that gets you to take traumatic memories, traumatic scenes from your past and your current life situation and transform the perception to complete the story, to change the story, to promote healing. And as a result, we've been able to see some amazing transformations in health and well-being. This show is dedicated to those brave people who allowed us to use them as case studies to document their process so that others who are suffering can gain from their insights and start their own healing transformations. Please feel free to comment, send an email, and follow the link, and let's continue the conversation. I hope you enjoy this episode. I first became very fascinated by PTSD when I was seeing patients that came in from car accidents. They would come in with their obvious neck aches and back aches, but then I would hear their stories and they would tell me how they would have troubles driving. They said, since my accident, I can't drive. What do you notice happens to you whenever you pass by that intersection?
I try not to pass by, but my friend lives just down there, so I take the other road.
Okay.
Yeah.
Why?
Because every time I drive by there, it comes back to me full force.
Is that right?
Yeah.
What they were telling me about essentially was that they had post-traumatic stress disorder. They label it a disorder, but you have to understand it's trauma-based. So the disorder was born based on an event. So I found it very intriguing that if you can change your perception about an event that was traumatic, could you change the disorder? And I discovered without a shadow of a doubt that if you had an open mind and open heart, you can change it by changing your belief and interpretation about that event and that stressful scene.
We're going out to recover a blown up striker. We started taking pop shots. I saw a flash. So I had a feeling it was coming from this building because there wasn't much in there.
So a sniper was coming at you, yeah.
I just unloaded the 50 cal. Made sure anything and everything on that floor, anything in that building is...
Do you still think about it?
Yeah, quite a bit.
You feel the guilt about it?
Yeah.
Okay,
Yeah.
all right.
My mom was killed in a car accident, and I was at the accident. I saw her being taken from the car and put on a stretcher.
So from that event, you had post-traumatic stress.
I was on the Iraqi Highway Patrol. So all of a sudden we see these cars just start to dissipate and go in every direction, which happens all the time. Start getting incoming fire. We engage it, we destroy it. I get on my vehicle and go to one of the vehicles, and basically inside it's a bunch of old ladies with no weapons, and they're all dead. So that was probably the worst one.
I enjoy researching all methods of healing, and the most powerful one that I've ever seen is the power of changing a perception of a traumatic event. One of my heroes, Gabor Mate, says it that most illnesses, chronic illnesses, whether it's ADHD or mental illnesses, depression, PTSD obviously, but even cancers and autoimmune disorders, have trauma at its root. In other words, they were born out of the stress of the trauma, and the person, as Gabor says, shuts down emotionally.
One of the impacts of early childhood trauma, such as I myself had experienced in infancy, is that you close down against vulnerability. When vulnerability of being emotionally open leads you into suffering, pain, then how you defend against that, or how your brain and body defend against it, is you close down against the feeling of deep emotion. That also shuts you off from deep love. And that same repression of emotion has been documented to also suppress the immune system.
I think I was 6 at that time. When the door opened, it was her son.
How old is he around?
18. He talked to me a little bit about the baby and how cute it was and stuff. And
so you went in?
Yeah. So I went in, and I don't remember anything except for being on the bed and then his mom coming home.
So people who get autoimmune diseases like scleroderma, systemic lupus, rheumatoid arthritis, are typically people who were traumatized in childhood and responded by the shutting down of emotion. ADHD, addiction, or depression, or psychosis. Cancer is the same thing, which also means that any modality that helps you get in touch with what's underneath the trauma and helps you put you in touch with those traumatic memories can potentially liberate you, which can also mean it can have a potentially healing effect on the illnesses themselves. And I've seen examples of that, and the research is full of examples of that.
So they bottle up their emotions, and that stress has to go somewhere. So it creates illnesses and growths and cancers soon after the advent of those traumatic experiences. Despite the fact that research is very clear that trauma has a part to play in most chronic problems, there's a gap between that research and the practical application of teaching medical doctors how to cope with that trauma.
Given the documented relationship, for example, between early childhood trauma and addiction, or childhood adversity and chronic physical illness, the real wonder of it is why doctors don't know about it. And I lecture to medical students at the University of British Columbia, and in 4 years, they never hear the word trauma in the sense of psycho-emotional trauma that affects the physiology. They only hear about physical trauma. So there's a deep gap between the research evidence and what doctors are taught and what doctors practice. So the only reason this is controversial is because of the utter exclusion of this kind of information from the education of most physicians. It's not controversial when you actually look at the information or the science of it. It's only controversial because of the gap between the evidence and medical awareness.
I'm going to show you why stress happens, why every negative emotion happens, why you have negative thinking, why you have anger, why there's depression and despair. There is a prevailing belief happening in the healthcare system that we need to diagnose and label these disorders. If I can convince you that you have a mental disorder, then I can convince you to be stuck on a therapy or a pill for the rest of your life.
They gave me, prescribed me different stuff. First I took it for the pain, but then I started using it to forget all the other shit that happened. So recently, within this last year, I just got a treatment for substance abuse and PTSD. So I don't really sleep too good, so they give me Ambien and Benadryl. For 8 years, I would stay away from people, stay in the basement, just get high pretty much. Not to get high, but just to forget shit.
I went through about 5 or 6 different types of antidepressants, and none of them really worked.
We have these mental disorders, and what we first do is treat them with drugs. Now we're seeing that it doesn't really work. It's not healthy long term. So let's go into alternative forms. Now you do yoga, whether you do meditation, whether you do affirmations. All of these things are trying to get you to heal from a disorder. But let me explain to you how it cannot possibly heal with that in mind. Every single time you go through stress of any kind, your body goes through a fight or flight state as though it's in danger. Blood pressure goes up under the effects of adrenaline and cortisol. Your digestive system shuts down, immune system shuts down, reproductive system shuts down in order to conserve energy for that fight or flight. So your body can only handle that for a short period of time. Afterwards, it starts to go into exhaustion phase. That's when the signs and the symptoms come up. And then lo and behold, you go to the doctor and you take pills. But the question never is asked, what's the environment that I'm in? And where is that tiger? Because the craziest understanding that you will ever know about this process is that whether or not there's a tiger chasing after you, or there is the fear of the tiger attack, your body actually reacts and responds the same. And now we get stuck in that fight or flight state for years. And I have yet to meet a PTSD case without the belief that it shouldn't have happened. Check it out.
I should not have been at the accident to see my mom being taken from the car.
Well, should have been a bunch of guys with some RPGs and weapons.
Well, it should have been me, yeah. I mean, out of 6 trucks pulling security, yeah. I shouldn't have had to kill somebody, I don't think.
And it was one person?
But no.
Several.
The first time.
The biggest underlying belief that creates post-traumatic stress disorder, when you have the belief that it shouldn't have happened.
Well, of course not.
Okay. As long as you hold on to the belief that I shouldn't have gone through that and it shouldn't have happened, he shouldn't have hit me, you will always have post-traumatic stress disorder.
I also think I shouldn't have gone through all my other...
Bingo. Healing is finished the moment you can say thank you.
Oh, that's hard.
I know.
Wow.
But I've found a tool to get you there the fastest way. And what's been the benefit to you that you've gone through that now? Did it push you out and wake you up and say, no, I'd rather work with plants now?
Yeah, well.
Sit with that one
yeah.
for a moment. Has that helped cultivate a love for nature and peace?
Yeah, absolutely.
Did that kind of help take that edge off after you went?
Yeah, because I was pretty,
You're pretty aggro before then?
yeah.
After
Brought
that?
me back down to earth a little bit. It grounded me, yeah.
What relationships have benefited because you went through that stressful scene?
My kids' relationship and I.
Sit with that one for a moment. Has it made you a better parent?
Yeah.
How?
Because I'm not as quick to snap anymore. Slow down a little bit. I think I have a lot more patience now.
What did that do to you to bring you patience? Humbled you?
Yeah.
Made you go, whoa, life is precious and there's more important things?
Yeah. Thanks. Yeah, for sure.
When you look at it now, 0 to 10, where is it? 0 is I wouldn't change a thing, I'm grateful. 10 is through the roof, which you said earlier.
I wouldn't change it now. 0.
What's the benefit that they didn't survive? What's the benefit to you?
That moment when I opened up the door to look inside the vehicle, the one lady was still alive and she was hitting me. It reminded me of my mom, like if I would have stole some money out of her purse. She wasn't hitting me like she was mad. She was hitting me like, you know what you just did. Like that's the first time I wrote one of them letters. Like I might not make it out of this. Wrote it home. Just apologized to my mom.
Sit with that one for a moment. Did that moment wake you up to the fact that you had to reconnect with mom?
Yeah.
Sit with that one for a minute. Shit. What's the benefit of you reconnecting with your mom?
Just I felt like I didn't have a chance to say everything I wanted to say before I left, and so I just want to tell her I was sorry for all the shit I did growing up. And
How did that serve your mom?
well, I made sure they're all ready together. Like even my aunt, well I call her aunt, but that's my foster mom.
What did that do for the two of them?
Brought them together. Like they haven't been that close since I went to Iraq.
Can you see that in every crisis there's a blessing? Can you see why you got into the accident now?
Yeah.
Can you see that you're not a PTSD victim?
Yes. Oh my God, who made that stupid label?
Do you still think it shouldn't have happened?
No, it should have happened. Of course it should have happened.
In reality, I should have been a witness to my mother's death at that time
Because?
because she would have wanted me there. I was the only one strong enough to do it.
I started taking these patients and one by one going through the overview method with them, taking their perception of that stressful scene in the car accident, for example, and getting them to look at it from a different perspective. And what they would notice is they would get in the car and they would drive without fear.
Okay, here we are.
Where are we?
Right here.
This is
I'm
the
gonna
scene of the
turn
accident.
left,
Turn
okay?
left? Okay.
Yeah.
So this is where you got hit?
This is where I got hit because I was turning left.
You were turning left, so you're
Oh
gonna...
my God, I'm turning left on Dover.
This is a big deal for you?
Yeah.
Okay.
Because this is where I got hit, right?
This is by turning left. You
Yeah.
got hit from behind.
That's right.
I'm
Yeah.
just watching behind us, 'cause- just from karma. PTSD becomes a label or a diagnosis that gets slapped on your forehead and it becomes your identity if that identity serves you. Once you overcome that belief that it's my identity and you're ready to move past that, you then realize that it's not the event that caused you to feel that way. It was your interpretation of that event. You're not doing it on purpose and you're not a bad person if that's where you are. It's just time to realize that you can actually change that identity. So it was a year and a half ago we had that session. Do you still have PTSD? Like we just had that one session, we never met again.
It's gone. Like it is gone.
How do you feel? Do you get those fight or flight symptoms?
None of those feelings. Those feelings are completely gone. I don't panic, there's no anxiety. Having gone through the behavior therapy, numerous psychologists, the medications, the whole gamut of everything.
For how many years?
20 years.
How long did it take us to clear that?
A couple minutes. I'm no longer on any medication.
Chronic pains, fibromyalgia, depression, insomnia.
No.
You had PTSD for 20 years.
Yeah.
Would you say that PTSD is a disease or a disorder? How would you classify it?
I would just, I don't even know if you can classify it because you shouldn't classify it. It shouldn't have a label. That should not have a label. It should just be something that people are experiencing that they need to work through and change their perception.
past 8 years since you've done this?
It just made me look at things differently.
Do you feel a lack of self-esteem? Do you feel that there were mistakes? Do you feel like you're a bad person? Or do you feel like you have a potential here?
For that incident, I feel better for that incident, truthfully. I mean, there's many more.
Exactly.
But
so you can do the same process on each of those.
Yeah.
Can you see a method or a tool like this helping other people in your situation?
Yeah.
If they're open?
I'd say yes, yeah.
Do you feel like you need therapy now?
Not for that. It's
done.
Yeah.
The issue's done. When you can say thank you for the issue, then you don't need therapy anymore. But it's a tall order to get there. You have to be humble, you have to be willing to look, and you have to be real. And you were all of those things. And that's how this works. You did awesome, bro.
Appreciate it.
SD, they say you're gonna be living with it for an eternity. So take these medications so that you don't have to see the demons in your mind that you're begging to flee. You gotta work hard, you gotta wanna overcome. The task of transcending a label's not an easy one. Who would you be without this identity set free? Would your heart be filled with glee, project an expectation on something to be against what history and fate had it to be? Now the past is threatening to be your destiny. I've been saying it for years, but no one's hearing my plea. Disorder transforms when you change the story. The suffering dissolves. Inside you is the key. The illness doesn't have to be your reality. You got to wake up and take over the responsibility. Pills don't teach skills. You gotta look inside if you wanna find the answer to your ills. Pills don't teach skills. Covering the truth in exchange for your dollar bills. I said pills don't teach skills. You gotta look inside if you wanna find the answer to your ills. Pills don't teach skills. Covering the truth in exchange for your dollar bills. When they tell you let it go, you can try with all your might. The problem's at your nervous system, still in fight or flight. Your stress ain't gone, it's still in plain sight. You gotta find a way to turn around the fight. My name is Dr. Nima, adjusting spines is my game. Now I'm spitting lyrics, to me it's all the same. Correcting your structure, improving what you eat. Dissolving your stress by adjusting your beliefs. I wasn't born a rapper, but I'm a rapper at heart. It connects me to my young and my playful part. I'm in my late 30s, is that too late to start? What I'm lacking in my rap technique I make up for with heart. The dancing, the rhymes, healing spines and minds. Combining everything you love makes you feel fine. So don't hold back if there's a song you need to sing. And dance like you don't care who's watching. Pills don't teach skills. You gotta look inside if you wanna find the answer to your ills. Pills don't teach skills. Covering the truth in exchange for your dollar bills. I said pills don't teach skills. You gotta look inside if you wanna find the answer to your ills. Pills don't teach skills. Covering the truth in exchange for your dollar bills.